revolutionary breast cancer test could save up to 5,200 women the ordeal of chemotherapy every year. A revolution in breast cancer treatment will spare thousands of women from the ordeal of chemotherapy, British scientists believe. They are carrying out a landmark trial which involves patients undergoing a genetic test shortly after being diagnosed with cancer. This determines how aggressive the cancer is, whether chemotherapy is needed, and if tumors are even likely to respond to the debilitating treatment. Researchers from University College London, who are behind the trial, say that the test could allow up to 5,200 patients to avoid chemotherapy each year. Chemotherapy is the mainstay of cancer treatment, and it is given to approximately 16,000 breast cancer patients in England every year. But it causes crippling side effects including exhaustion, infections, sickness, and hair loss, which are usually far worse than symptoms of cancer itself. Stella Green found out 3 weeks ago that she does not need to have chemotherapy. Hearing the news made her cry tears of sheer relief. Mrs. Green, 71, had been dreading chemotherapy ever since being diagnosed with breast cancer in July. After having surgery to remove the tumor in August, Mrs. Green, from Harrow, northwest London, was referred to the Mount Vernon Cancer Centre in Northwood, where doctors told her about the trial. "I just wanted to do it because I feel in the future it's going to help other people. I want to help other women," she said. After a sample of her tumor was examined, Mrs. Green, a widow with 2 granddaughters, was told that her breast cancer was estrogen-induced and slow-growing, so chemotherapy would be of limited benefit. She said, "That's the first time I've cried throughout the whole thing." Tears of relief. Instead, she will start a daily course of estrogen-reducing pills called letrozole and take them for next 5 years, as well as a 2-week course of radiotherapy. Mrs. Green said it has allowed her to carry on with her fairly active lifestyle and social life. "Not having to have the chemo has been a marvelous thing, as far as I'm concerned," she added. "If what I'm doing helps other people avoid that, then I'm really happy." Many patients say they never fully recover, and it can lead to heart damage, leukemia, a type of blood cancer, and in some cases, death. Yet researchers believe that the majority of patients don't benefit from chemotherapy and would be just as well taking daily estrogen-reducing tablets, which have far fewer side effects. The trial, which was launched in January, is funded by the NHS and is overseen by scientists at UCL, Cambridge University and Warwick University's Clinical Trials Unit. It involves 4,500 patients. Called Optima, it is the first of its kind to measure how well chemotherapy will work for a patient, or chemotherapy sensitivity. The early findings will be presented next week at the National Cancer Research Institute's conference, the UK's largest cancer conference. The test, called Prosigna, is carried out by a machine which measures the activity of 50 genes taken from a small sample of a breast cancer tumor. Each patient is given a score out of 100 based on how aggressive their cancer is and whether chemotherapy would prove effective. Chemotherapy works by killing fast-growing cells, so, in theory, it only would be worthwhile in patients with aggressive, fast-growing cancers. The trial will run for 6 years, during which time researchers will compare the survival rates of patients treated with chemotherapy with those only given tablets. If the test is found to be safe and cost-effective, as the researchers expect, it will be rolled out across the NHS. They also calculate it would save the health service £17 million a year from not administering chemotherapy, which costs an average of £4,000 a course. While the trial is underway, the scientists are hoping to make the test even more accurate, so it can enable more women to avoid chemotherapy. Professor Rob Stein, lead researcher from University College London, said it was the first step in an entirely new approach to treating breast cancer. "If we can put chemotherapy behind us and discard it for those people that it's just not going to help, then we can move on to things that will help. We can reduce chemotherapy very substantially in that group of women. Around 1 in 8 women develop breast cancer during their lifetime. There are just over 55,000 new cases a year in the UK and around 11,400 deaths. Approximately a third of women diagnosed with breast cancer in any given year will have chemotherapy that same year. There are currently 65 hospitals involved in the trial and recruiting patients, but researchers want another 40 to join. Patients will initially have surgery to remove the cancer and radiotherapy to get rid of any remaining cells, after which a sample of tumor will be tested. Depending on their